Welcome to Brain Imaging Essentials Expanded, Part 2, Brain Imaging Anatomy. I am David Lee Gordon, Professor of Neurology. The learning objectives for this presentation are these. Upon viewing this presentation, learners will be able to identify neurologic structures on brain CT and MRI scans, including the brainstem and its components, medulla, pons, and midbrain, and cerebellum, cerebrospinal fluid structures, including all four ventricles, sylvian aqueduct, quadrigeminal plate cistern, perimesencephalic cistern, suprasellar cistern, sylvian fissure, and interhemispheric fissure, deep white matter structures, including the corpus callosum, internal capsule, corona radiata, and centrum semiovale, subcortical gray matter, including thalamus, lentiform nucleus, which is composed of the globus pallidus and putamen, and caudate nucleus, and the cerebral cortex, areas, frontal, parietal, temporal, and occipital lobes, and insula, and arteries around the circle of Willis, and the arterial branches, middle cerebral, anterior cerebral, and posterior cerebral arteries. In addition, learners will be able to identify the following arteries on CT angiography or MR angiography: vertebral, basilar, posterior cerebral, common carotid, internal carotid, middle cerebral, anterior cerebral, and posterior communicating arteries. Learners will be able to identify the four main segments of the internal carotid artery on CTA and MRA, the cervical, petrous, cavernous, and supraclinoid, and learners will be able to identify the following venous structures on MR venography: superior sagittal, inferior sagittal, transverse, sigmoid, and straight sinuses, jugular, internal cerebral, and cortical veins, basal veins of Rosenthal, great vein of Galen, and the torcular hierophili. When identifying anatomy on brain imaging, it is best to keep a three-dimensional perspective, and that means understanding the way the brain sits in the three cranial fossae. Progressing from inferior to superior, axial slices first visualize the posterior fossa. So slice A is the most inferior slice, and you can see the posterior cranial fossa outlined in orange and shown with the orange arrow on slice A. The next slice up, going higher, the axial slices go through the middle cranial fossa, outlined in green and shown with the green arrow on slice B. Then higher up, the axial slice shows the anterior cranial fossa, where the frontal lobe sits. And this is outlined in yellow with a yellow arrow. So as you go up from the bottom to the top of the brain on axial images, you'll see the brainstem in the posterior fossa, then the temporal lobes in the middle cranial fossa, and then finally the frontal lobes in the anterior cranial fossa. We will now view multiple CT scan axial images in the same patient, demonstrating normal anatomy. In the upper right corner of each of these slides is a sagittal MRI showing you the level of the slice depicted. On this image, see if you can identify the structures listed on the left before proceeding. I'm guessing you had minimal difficulty identifying the nose. The eyes also are not difficult to identify. Note the hyperdense or white oval-shaped structures in the anterior aspects of the eyes are the lenses. The sphenoid bone is one of the bones that forms the orbit. Here, the inferior aspect of the temporal lobe is seen in the middle cranial fossa. The bony clivus is anterior to the brainstem. The word clivus means slide. It sits at an angle in front of the brainstem, and the basal artery courses rostrally between the brainstem and the clivus. The clivus will extend up all the way to form the sella turcica. In addition, the sixth nerve, cranial nerve 6, exits mid-pons and travels up the clivus before entering the cavernous sinus. The petrous bone, or the petrous aspect of the temporal bone, houses the inner ear. The arrow on this slice is pointing to the black mastoid air cells. Recall that air is hypodense or black on a CT scan. The mastoid air cells are thought to help regulate pressure in the ear and can become infected when ear infections spread to the adjacent bone, causing mastoiditis. This can then lead to cerebral vein thrombosis because the sigmoid sinus runs along the inner groove of the bone where the mastoid air cells are. The pons is seen in the center of this slice. Remember, the word pons means bridge in Latin, and it bridges the two other components of the brainstem, the medulla below it and the midbrain above it. When you see the pons on an axial image, of course, behind it lies the cerebellum. Please also note that the cerebellum crosses the midline. There is no fissure in between the two sides of the cerebellum. This is a slice more rostral, as you can see in the upper right corner. Again, on the sagittal image, mid-sagittal image, you see the slice level where the slice comes from. Pause for a moment and take some time to see if you can identify the structures that are listed on this slide. The eyes are once again easy to identify. Note now that the image is slightly asymmetric. You can see the lens is still partially seen in the right eye and not seen at all. We're above the level of the lens in the left eye. The optic nerve is the structure entering the eye posteriorly. Note that we only see the right optic nerve, not the left optic nerve, because of the asymmetric way the slices were obtained. The lateral rectus is the muscle lateral to the eye that abducts the eye. The medial rectus is the muscle medial to the eye that adducts the eye. The sphenoid bone is seen once again, forming the posterolateral aspect of the orbit. At this level, we more clearly see the temporal lobe in the middle cranial fossa. Note the streaky, bony artifact obscuring the parenchyma in the temporal lobe. The sella turcica, which literally means the Turkish chair, houses the pituitary gland. Dorsum celli literally means back of the chair. This is the bony extension of the clivus that does serve as the back of the sella turcica. Once again, we see the petrous bone forming the posterior aspect of the middle cranial fossa. Once again, we see the mastoid air cells. Here we see the pons in the middle of the brainstem, the faint, slightly hyperdense, round structure in front of it is the basilar artery between the pons and the dorsum celli or clivus. Brachium pontus literally means arm of the pons. As you can see, it's an extension connecting the pons to the cerebellum. It is also known as the middle cerebellar peduncle. The fourth ventricle lies posterior to the cerebellum and anterior to the vermis of the cerebellum. It is black because it consists of cerebrospinal fluid. The cerebellum lies behind the pons in the posterior fossa. Note that the cerebellum parenchyma goes across the midline. The central part of the cerebellum is called the vermis. There is no fissure or CSF structure in between the two sides of the cerebellum. We are now one slice higher up. See if you can identify the structures listed on this slide before proceeding. The frontal sinus is an air pocket within the frontal bone. Thus, it is black or hypodense on CT. At this level, we see the orbit above the eye. At this level, we are now able to see the frontal lobe in the anterior cranial fossa. The sylvian, or lateral fissure as it is sometimes called, is the largest fissure in the brain. At the level of this slice, it separates the frontal lobe anteriorly and the temporal lobe posteriorly. The middle cerebral artery runs in the sylvian fissure. Here you see the relatively hyperdense carotid artery in the circle of Willis. This is the temporal lobe. Anytime you see the sylvian fissure on an axial image, posterior to it will be the temporal lobe. Note also the very medial temporal lobe forms a little knuckle protrusion that is sometimes called the uncus, U-N-C-U-S. The suprasellar cistern, the large central cerebrospinal fluid space above the sella, has 6 points. The point at the top, most anteriorly, is the interhemispheric fissure. The upper corners go to the sylvian fissures. The bottom corners go to the perimesencephalic cisterns, and the most posterior point centrally is the interpeduncular cistern. The perimesencephalic cisterns are CSF spaces surrounding the midbrain. In fact, peri means around, mesencephalic means midbrain, around the midbrain cistern. Another name for it is the ambient cistern. The posterior cerebral arteries run in the perimesencephalic cisterns. The perimesencephalic cisterns commonly fill with blood during subarachnoid hemorrhages and also become obscured when the temporal lobe, specifically the uncus of the temporal lobe, herniates and compresses down on the brainstem during uncal or transtentorial herniation. We are now at the midbrain level of the brainstem. The midbrain is recognizable by the two smaller lumps dorsally or posteriorly called the colliculi, and more anteriorly or ventrally the larger rounded lumps, as it were, that form the cerebral peduncles. Just dorsal to or behind the midbrain is the CSF space called the quadrigeminal plate cistern. It is called this quadrigeminal, 4 twins plate cistern, because of the 4 colliculi. So there are 2 superior colliculi in the midbrain and 2 inferior colliculi. Remember, colliculus means hill in Latin. So these little bumps, 4 bumps on the dorsal part of the midbrain, or 4 twins. And this term, quadrigeminal plate cistern, refers to those colliculi, 4 twins. That the twins area, the quadrigeminal plate, is also known as the tectum. The tectum means roof, and it's called that because it roofs the sylvian aqueduct, which lies just beneath those colliculi, just beneath the quadrigeminal plate. This quadrigeminal plate cistern is commonly filled with blood during subarachnoid hemorrhages and may be obscured when there is diffuse cerebral edema. The cerebellum lies posteriorly or dorsally to the brainstem still. Note that there is still parenchyma centrally, medially, in the cerebellum. That's the clue that you're not yet up in the occipital area. The occipital area would have a fissure between the two sides. Cerebellum does not. It has parenchyma in the middle, medially, called the vermis.
We continue to move rostrally, and now on slice 4. See if you can identify the structures listed on this slide before proceeding to the next slides. Anteriorly or ventrally at this level, we see the frontal lobe. In between the frontal lobes, we see the CSF space called the interhemispheric fissure. At this level, we continue to see the sylvian or lateral fissure separating, in this image, the frontal lobe from the temporal lobe, and again, where the middle cerebral artery runs. In fact, we do see the middle cerebral artery, this isodense tube running from the circle of Willis into the sylvian fissure. At this level, laterally, we see the temporal lobe. Once again, if you see the sylvian fissure on an axial image, just dorsal to it will be the temporal lobe. These small slits of black CSF space in the temporal lobes are the temporal horns of the lateral ventricle. In normal patients, these temporal horns are very small. They only become enlarged with diffuse atrophy of the brain or focal atrophy of the temporal lobe, or when there is compression on one side leading to hydrocephalus on the other side. But normally, the temporal horns are small slits within the temporal lobe. Here we see the posterior cerebral artery, an isodense tube coming from its origin in the basilar artery and beginning to wrap around the midbrain and about to enter the perimesencephalic cistern. Here we see more clearly the six-pointed star called the suprasellar cistern. Once again, the cistern point ventrally or anteriorly goes into the interhemispheric fissure. The ventral corners go into the sylvian fissures. The dorsal corners go into the perimesencephalic cisterns, and the most dorsal point is actually the interpeduncular cistern. The circle of Willis sits in the suprasellar cistern. And once again, we see the perimesencephalic or around the midbrain cistern, or also called the ambient cistern, where the posterior cerebral artery will run, and which is again obscured when there is uncal herniation or full of blood. It becomes white on a CT scan when there's subarachnoid hemorrhage. The interpeduncular cistern is the small CSF space in between the two cerebral peduncles of the midbrain. Often you might see the top of the basilar artery here. At this level, we continue to see the midbrain, now more superiorly, the superior aspect of the midbrain, with its distinct shape. Ventrally, we see the two rounded cerebral peduncles within the midbrain, and dorsally, we see the smaller humps called the superior colliculi. If you look very carefully, right in the middle of the two superior colliculi, and maybe just ventral to those colliculi, is a black dot, which is the sylvian aqueduct, also known as the cerebral aqueduct. Still at this level, we see the CSF space behind or dorsal to the midbrain called the quadrigeminal plate cistern. At this level, we see the parenchyma right behind the midbrain, right behind the quadrigeminal plate cistern, that's still part of the cerebellum. And this central part of the cerebellum is called the vermis, which literally in Latin means worm. We also, at this level, however, see the occipital lobe behind the cerebellum. Cerebellum, more rostrally, is peaked like a tent, and so you see the cerebellum vermis right behind the quadrigeminal plate cistern, but behind the cerebellum, you'll notice that there is a linear whiteness or hyperdense area right behind it that is dura. And so because you have this dural structure in between the two sides, you now have the occipital lobe. The occipital lobe is separated into two sides with a dura in between or fissure in between. Note the appearance of a wine goblet. If you look at this carefully, the vermis is the top of the wine goblet and the stem is the dura beneath it. When you see this structure, you know that the wine goblet, the center, the glass of the wine goblet, is actually the vermis, and behind it, where there's a stem, there's occipital lobe behind the cerebellum at this level. We continue to move rostrally. We are now on CT slice 5. Take a moment to see if you can identify the locations of the structures listed on this slide. Ventrally, we continue to see the frontal lobe. In between the frontal lobes, we see the CSF space called the interhemispheric fissure. The anterior cerebral arteries run in the interhemispheric fissure. At this level, the sylvian or lateral fissure has a different appearance. Notice it looks more like a T at this level, separating the temporal operculum from the insula and frontal lobe. At this level, you might see small, round, middle cerebral artery branches within the sylvian fissure. At this level, we can see more medially now the third ventricle. We continue to see the temporal lobe laterally. Once again, if you see the sylvian fissure on an axial image, then dorsal to it will be temporal lobe. At this level, the temporal horn is seen more dorsally as it runs back to join the body of the lateral ventricle. Note that because this CT scan was obtained slightly asymmetrically, we only see the temporal horn on one side, but it is common for the temporal horns to be very small in a normal person without cerebral atrophy. Here we more clearly see the black dot consisting of the CSF structure, the sylvian or cerebral aqueduct that is in the dorsal midbrain. This is that aqueduct that connects the fourth and third ventricles. We continue to see the vermis of the cerebellum right behind the quadrigeminal plate cistern or behind the midbrain, midline. At this level, we continue to see the occipital lobe behind the cerebellum. Once again, the wine goblet appearance tells us that the occipital lobe is there behind the cerebellum, with the glass of the wine goblet being the vermis and the stem of the glass being the hyperdense meninges or falx between the two cerebral hemispheres, between the two occipital lobes. Here we see the hyperdense dural structure called the falx in between the two cerebral hemispheres, in this case between the two occipital lobes. And as mentioned previously, the falx looks like the stem of a wine goblet at this level. We now move one slice rostrally to slice 6. Pause for a moment and see if you can identify the structures listed on this slide before proceeding. We continue to see the frontal lobe ventrally. We now see the black CSF space called the frontal horn of the lateral ventricle. Just lateral to the frontal horn of the lateral ventricle is the head of the caudate nucleus, a lighter gray structure because it's composed of compact neurons, and this forms part of the basal ganglia. At this level, we continue to see the sylvian or lateral fissure. At this level, the ribbon of light gray cortex just medial to the sylvian fissure is called the insula. The word insula in Latin means island. This area is isolated between lobes, and that's why it's called the insula. And it is a very important structure to look for in patients with middle cerebral artery infarctions. The external capsule is a strip of darker gray white matter that lies between the insula laterally and the lentiform nucleus medially. The lentiform nucleus is this lens-shaped or triangular-shaped light gray structure in the middle of the brain. It is part of the basal ganglia and consists of the globus pallidus medially and the putamen laterally. The posterior limb of the internal capsule is the strip of darker gray white matter that lies between the lentiform nucleus laterally and the thalamus medially. The thalamus is this oval or egg-shaped light gray structure medially in the brain. It serves as a relay station for sensation and consciousness and has other responsibilities such as related to memory, etc. At this level, we continue to see the temporal lobe just dorsal to the sylvian fissure. The hyperdense white structure that appears to be floating in the third ventricle is actually the pineal gland. It is normally calcified and therefore bright on a CT scan. At this level, we see the atrium or trigone of the lateral ventricle. This section is called atrium because atrium means the central room of a Roman house. So this area is where the temporal horn and the lateral body and the occipital horn all come together into this central room called the atrium. Because 3 different CSF lateral ventricle structures enter this area, it's also known as the trigone. Again, the 3 components, lateral ventricle, body, occipital horn, and temporal horn, all come together in this area called the atrium or trigone. In this image, we see a white or hyperdense area within the atrium. This is the choroid plexus. The choroid plexus makes cerebrospinal fluid and is commonly calcified, so will appear white on CT scans commonly, and it is commonly seen within the atria of the lateral ventricles. Dorsally in this image, we see occipital lobe. Note that there is fulx, or a hyperdense line between the two cerebral hemispheres, throughout the posterior aspect or dorsal aspect of this image. Therefore, we are now above the cerebellum and in occipital lobe. We are not above the occipital lobe because we still see temporal lobe. So at the levels you see temporal lobe, the posterior or dorsal aspect of the brain will be occipital lobe. We now move one slice rostrally to slice 7. Pause for a moment and see if you can identify the structures listed on this slide before proceeding to the next slides. We continue to see the frontal lobe, the ventral aspect of the brain. The black CSF structure in between the two cerebral hemispheres is the interhemispheric fissure. The corpus callosum is the thick band of white matter that connects the two cerebral hemispheres. The anterior aspect of the corpus callosum is called the genu of the corpus callosum. The genu lies just anterior to the lateral ventricles. The posterior most aspect of the corpus callosum is called the splenium of the corpus callosum. The word caudate in Latin means tail, and the caudate nucleus is a tail-shaped structure that follows the lines of the lateral ventricle. Here we still see the head of the caudate nucleus cut in cross-section. The caudate nucleus is part of the basal ganglia and is composed of densely packed neurons. It's a gray matter structure. Thus, the color is a lighter gray, just like the cerebral cortex. At this level, we see the body of the lateral ventricle, the large black CSF structure in the middle of the brain. The bodies of the lateral ventricle arch over the thalami, and on top of the thalami lie the choroid plexus. In this slice, we see the thalamus or choroid plexus seen as a consequence of volume averaging, seemingly within the ventricle, but actually just beneath the ventricle. At the level in which you see the prominent curved bodies of the lateral ventricle, the deep white matter is called the corona radiata, or radiating crown. Anteriorly, the deep white matter is called the forceps minor. This is the anterior aspect of the corona radiata emanating from the genu of the corpus callosum. Posteriorly, the corona radiata is called the forceps major, and this is the corona radiata emanating from the splenium of the corpus callosum. The area of cerebral cortex posterior to the central sulcus is the parietal lobe. This slice is still inferior enough to be able to see the occipital lobe in the posterior aspect of the cerebrum. The white or hyperdense line separating the two cerebral hemispheres is part of the dura called the falx. On a CT, the black or hypodense CSF-filled wrinkles in the cerebral cortex are called sulci, or individually a sulcus. We now move one more slice rostrally to slice 8. Pause here for a moment and see if you can identify the structures listed on this slide before proceeding to the next slide. The frontal lobe continues to be seen in the ventral aspect of the brain. We still see the black line of CSF in between the two cerebral hemispheres called the interhemispheric fissure. Once again, we see the band of white matter connecting the two cerebral hemispheres called the corpus callosum, and the anterior aspect specifically called the genu of the corpus callosum. Note that at this level, one can appreciate the tail shape of the caudate nucleus. The body of the caudate nucleus at this level is easily seen to run along the lines of the lateral ventricle. We now are at the top of the lateral ventricle bodies. As long as we still see the bodies of the lateral ventricle, the deep white matter is called the corona radiata. At this level, the posterior part of the brain is the parietal lobe. We are now too rostral to see the occipital lobe. Once again, we see the hyperdense dural falx separating the two cerebral hemispheres. We now come to CT slice 9, the rostralmost slice in this presentation. Pause for a moment and see if you can identify the structures listed on this slide before proceeding to the next slide. At this level, the cerebral cortex anterior to the central sulcus remains the frontal lobe. In between the two hemispheres lie both the interhemispheric fissure, a CSF structure, and the falx, a dural structure. At this level, when we no longer see the lateral ventricles, the deep white matter is called the centrum semiovale because it is in fact in the central part of the brain and is semi-oval. The parietal lobe makes up the posterior aspect of the brain on this slice, posterior to the central sulcus. We remain too rostral to see the occipital lobe. On this slide, the arterial territories are shown in color on CT brain axial image and on a coronal view for further clarification. The middle cerebral artery territory is red, the anterior cerebral artery territory is blue, the posterior cerebral artery territory is yellow, and the anterior choroidal artery territory is green. To further our perspective of brain imaging anatomy, we are now going to review an MRI T1 sagittal view in the midline. Please note that the sylvian aqueduct is in the midline and is as thin as a pencil lead, so the presence of sylvian or cerebral aqueduct on an MRI sagittal view indicates that the slice is midline. As we go through the anatomic structures listed on this slide, we will eventually get to the structure that is in fact the sylvian or cerebral aqueduct. Pause for a moment and see if you can identify the structures listed on this slide before proceeding to the next slides. Fat is hyperintense or white on a T1 image. So the outermost white band in this image is the scalp. The next layer is the skull, and note that the skull has 3 distinct layers that are different colors on an MRI. The outer layer is black or hypointense, composed of calcified compact bone. The middle layer, the white layer, is composed of fatty marrow in the spongy bone, and then the innermost layer is also black, once again composed of calcified compact bone. The front part of the brain is, not surprisingly, the frontal lobe. In the mid-sagittal MRI, we can now see the entire band of white matter called the corpus callosum, including the anterior aspect called the genu and the posterior aspect called the splenium. In the midline sagittal image, we clearly see the top of the brainstem called the midbrain. The optic chiasm, where the 2 optic nerves cross, is seen here just above the sella. Sitting in the sella is the pituitary gland. Recall that normal blood flow is black on a T1 image. And here we see the long black tube lying in front of the pons and behind the clivus, called the basilar artery. The middle part of the brainstem is called the pons, which literally means bridge, and it does in fact bridge the lower medulla to the upper midbrain in the brainstem. The clivus is the bony slide anterior to the basilar artery and pons, extending up from the vertebrae and with the skull posteriorly forming a canal where the brainstem and cerebellum sit. Superiorly, rostrally, the clivus extends up to form the sella turcica, where the pituitary gland sits. This large structure in the mouth is the tongue. The supero-posterior aspect of the brain in this image is the parietal lobe. The sylvian or cerebral aqueduct connecting the fourth ventricle caudally to the third ventricle rostrally runs in the ventral aspect of the midbrain. Here you can see the very thin black line within the midbrain is the sylvian or cerebral aqueduct. The bumpy structures dorsal to the sylvian aqueduct are the colliculi, which means hills in Latin. This is also known as the tectum in Latin because tectum means roof, and the colliculi form a roof over the sylvian aqueduct. The black tube in the midline, running just underneath the scalp, is the venous structure, the superior sagittal sinus. The posterior inferior aspect of the cerebrum on the mid-sagittal image is the occipital lobe. It lies posterior to the parieto-occipital sulcus. The black tube running just inferior to the occiput and superior to the vermis of the cerebellum, running in the folds of the falx, is the straight sinus. This is a venous structure that drains the deep cerebral veins. The cerebellum lies inferior to the occiput, straight sinus, and tentorium cerebelli, and posterior to the fourth ventricle and pons. The midline cerebellum is called the cerebellar vermis. On T1 images, CSF is black, and here this triangular shaped CSF structure anterior to the cerebellum and posterior to the pons is the fourth ventricle. The medulla or medulla oblongata is the caudalmost aspect of the brainstem, lying just superior to the spinal cord. This slide shows all of the structures on the MRI T1 sagittal view labeled with their arrows. We will now review the anatomy of major arteries in the brain using non-contrast MR angiography or MRA. We will look at both the axial view and the coronal view to gain a 3D perspective of the arteries. Pause for a moment and see if you can identify the individual arteries on each of these images prior to proceeding to the next slides. Note how well you can see the circle of Willis on the axial view and even on the coronal view as well. The arrows on this slide point to the anterior cerebral arteries. We clearly see the middle cerebral arteries in both views on this slide. The arrows on this slide are pointing to the internal carotid arteries in the cavernous or siphon portion in which the carotid artery, internal carotid artery, has an S shape. The posterior communicating artery is well seen on the axial view, connecting the internal carotid artery to the posterior cerebral artery. The PCOM, or posterior communicating artery, is less well seen on the coronal view, but if one looks carefully, one can see the small artery again connecting the initial part of the posterior cerebral artery to the internal carotid artery. The basilar artery is best appreciated on the coronal view. You can also see it on the axial view, cut in cross section. The posterior cerebral arteries are best seen on the axial view. Note that they curve around the brainstem when going posteriorly. If you look at the coronal view, you can also see how the PCAs are rounded laterally because they are surrounding the midbrain. They're going into the perimesencephalic cistern around the midbrain as they proceed to supply the inferior temporal lobe and occipital lobe. The vertebral arteries are well seen on the coronal view. They are not seen on the axial view because the axial slice is too rostral. The two posterior inferior communicating arteries coming off of the vertebral artery are easily seen on the coronal view. They're not seen in the axial view because the axial slice is too rostral. CT angiography, or CTA, of the neck and head have become increasingly more important in the treatment of patients with acute ischemic stroke. Let's review the anatomy first of the CTA neck. The main arteries and veins are labeled with letters on these two CTA images, moving from caudal to rostral. See if you can identify the labeled structures prior to proceeding to the next slide. A identifies the vertebral arteries, B the jugular veins, C the common carotid arteries, D the internal carotid arteries, and E the external carotid arteries. Note the vertebral arteries traveling in the transverse process of the cervical vertebrae. And as is typical, the right jugular vein is larger than the left. The left, more caudal image shows the common carotid arteries. The right, more rostral image is at the level of the carotid bifurcation, where the internal and external carotid arteries separate. Let's review three more CTA neck images, moving caudally to rostrally. Can you identify the main arteries in these images before proceeding to the next slides with labels? Can you identify the arteries labeled A and B in these three CTA neck images? The arteries labeled A are the vertebral arteries. The arteries labeled B are the internal carotid arteries. Note that the vertebral arteries initially course through the transverse processes of the vertebrae in the left or caudalmost image, then curve out and up to enter the foramen magnum in the middle and right images more rostrally. Note the internal carotid arteries in the neck, called the ICA cervical segments, move anteriorly, separating from the jugular veins. Proceeding more rostrally, we now have three CT angiography or CTA head images. Can you identify the major arteries in these images before viewing them with labels attached? Are you able to identify the arteries labeled A, B, C, and D? The arteries labeled A are the vertebral arteries. The arteries labeled B are the internal carotid arteries. The artery labeled C is the left vertebral artery, and the artery labeled D is the basilar artery. Note that in this patient, the left vertebral artery is dominant and curves medially in the middle image to become the basilar artery seen in the right or more rostral image. Note the internal carotid arteries enter the Peters bones, seen in the middle image, and course anteromedially within the Peters bones, seen in the right or more rostral image. This is called, these segments of the internal carotid artery are called the ICA Peters segments. Can you identify the main arteries in these three CTA head images? Can you identify the arteries labeled on these three images? These three CTA head images are more rostral than the previous three CTA head images we discussed. In these images, the A is pointing to the basilar artery, and B is pointing to the two internal carotid arteries. Note the basilar artery courses rostrally along the belly or anterior aspect of the pons. Note the internal carotid arteries, after moving anteromedially within the Peters bones, resume a rostral course, then curve upward in an S shape within the cavernous sinus. These areas of the internal carotid arteries are called the ICA cavernous segments or the carotid siphons. These three CTA head images are more rostral even than the previous three images. Without the help of labels, are you able to identify the main arteries? Are you able to identify the arteries with labels? In these images, A refers to the basilar artery, B, the posterior cerebral arteries, C, the internal carotid arteries, D, the left middle cerebral artery M1 segment, and E, the anterior cerebral arteries. These images are at the level of the circle of Willis, suprasellar cistern, and midbrain. Note the basilar artery divides into the two posterior cerebral arteries. The internal carotid arteries at this level, the ICA supraclinoid segments, divide into the middle cerebral arteries, or MCAs, and anterior cerebral arteries. These CTA axial images were obtained on a slant, so the left MCA appears before the right MCA. For CTA head images 10, 11, and 12, we are moving even more rostrally. Can you identify the main arteries without the assistance of labels? Can you identify the arteries labeled on this slide? In these images, A is pointing to the posterior cerebral arteries, B, the middle cerebral artery M1 segments, C, the middle cerebral artery branches, D, the posterior communicating arteries, and E, the anterior cerebral arteries. Note the posterior cerebral arteries, or PCAs, wrap around the midbrain, traveling posteriorly in the perimesencephalic cisterns. Both MCA M1 segments appear in the left image, the caudalmost image. Only the right M1 segment appears in the middle and right images, since the CTA was obtained with the patient's head slanted. Note the MCA branches, the M2 and M3 segments, seen on cross-section in the sylvian fissures. This patient has prominent posterior communicating arteries bilaterally. At these levels, the anterior cerebral arteries, or ACAs, travel rostrally in the interhemispheric fissure. Our next topic in brain imaging anatomy is the cerebral synovenous system, specifically as depicted on MR venography, or MRV. The cerebral synovenous system consists of two components, the superficial system and the deep system. In the image on this slide, an MRV sagittal view, the superficial synovenous system is outlined by white arrows, and the deep synovenous system is outlined by black arrows with yellow borders. The superficial system consists of the superior sagittal sinus, cortical veins, transverse sinuses, and sigmoid sinuses. Together, the transverse sinus and sigmoid sinus are sometimes called the lateral sinus. The deep sinovenous system consists of the inferior sagittal sinus, great vein of Galen, internal cerebral veins, the basal veins of Rosenthal, and the straight sinus. The MRV on this slide and in the subsequent slides of this presentation are all done without contrast enhancement. Thus, the white appearance of the veins and sinuses are due to flow-related enhancement, not contrast. This slide shows an MRV or MR venogram of the same patient in sagittal view and coronal view. Can you identify the specific sinovenous structures? The red arrow points to the superior sagittal sinus, the largest of the cerebral sinovenous structures. The superior sagittal sinus is midline and forms in the folds of the falx or dura at the top of the head. Blood flows posteriorly from anterior to posterior, and the blood from the superior sagittal sinus drains into the torcular hierophili. The blue arrow points to a cortical vein. Cortical veins in the cerebral hemispheres drain into the superior sagittal sinus. The maroon or dark red arrow points to the great vein of Galen. The great vein of Galen is thick, but it's actually quite short and is a major vein within the deep cerebral system. The purple arrow points to the straight sinus, formed by folds of dura in the falx and tentorium cerebelli. The straight sinus lies just inferior to the occipital lobe and superior to the cerebellum, and is the main drain for the deep cerebral sinovenous system. The straight sinus drains into the torcular hierophili, just like the superior sagittal sinus. The green arrows point to the torcular hierophili, which literally means winepress of Hierophilus. The torcular hierophili is sometimes called the confluence of the sinuses. And in this particular patient's MRV, one can see that it does appear to be a confluence, meaning that the superior sagittal sinus and straight sinus meet together in the same place and drain laterally into the transverse sinuses. In many patients, however, the torcular hierophili area is not truly a confluence, and the superior sagittal sinus, draining the most amount of blood from the cerebral hemispheres, drains directly into the right transverse sinus without communicating with the straight sinus, and the straight sinus drains directly back into the left transverse sinus. The pink arrows point to the transverse sinuses that form in the folds of the tentorium cerebelli behind the cerebellum. In this patient, as is typical, the right transverse sinus is more prominent than the left transverse sinus, because the right transverse sinus typically receives blood from the superior sagittal sinus, which drains the large cerebral hemispheres, whereas the left transverse sinus typically drains blood from the straight sinus, which in turn drains blood from the smaller volume of tissue in the deep structures of the brain. The transverse sinuses proceed to empty into the sigmoid sinuses laterally. The turquoise arrows point to the sigmoid or S-shaped sinuses. The sigmoid sinuses receive blood from the transverse sinuses and drain into the jugular veins. The sigmoid sinuses lie lateral to the cerebellar hemispheres. The black arrows point to the jugular veins, which carry venous blood from the brain via the neck to the heart. We will now take a closer look at the deep sinovenous system on MRV. Can you identify the structures listed on this slide without the help of labels? The blue-green arrow points to the inferior sagittal sinus, which forms in the folds of the dura in the inferior-most aspect of the falx and drains into the straight sinus. The maroon arrow points to the great vein of Galen, the wide but short vein that drains blood from the deep structures of the brain and joins the inferior sagittal sinus in draining into the straight sinus. The purple arrow points to the straight sinus, which, as described before, lies in the folds of the falx and tentorium cerebelli, receiving blood from the deep structures and draining into the torcular hierophili. The orange-red arrow points to the internal cerebral vein. The two internal cerebral veins arch over the thalami and drain into the great vein of Galen. The black arrow points to the basal vein of Rosenthal. The two basal veins of Rosenthal curve under the thalami and drain into the great vein of Galen. On this slide, all 5 major structures in the deep sinovenous system are labeled. To reiterate, the majority of the cerebral hemispheres drain into the superior sagittal sinus. And in most people, the superior sagittal sinus actually drains directly into the right transverse sinus, and the straight sinus drains directly into the left transverse sinus. Thus, the torcular hierophili is usually not a true confluence, even though it is often called confluence of the sinuses. And the right transverse sinus is usually larger than the left transverse sinus. The inferior sagittal sinus also is variable in its appearance on MRV. The inferior sagittal sinus runs in the bottom fold of the falx cerebri. It is often atretic and not well visualized, and that is a normal variant. You can see in these two MRVs, sagittal views, that the inferior sagittal sinus is not well seen in the image on top and is well seen in the image below. These are normal variants.
After viewing this presentation, you should be able to accomplish the stated learning objectives reproduced on this slide for your review. This is the end of this presentation, a production of DLGINSITE, Innovative Neuroscience Ideas and Thoughts on Education.